Recent protests sweeping the nation have put a spotlight on racial inequality. However, it is not just a social issue. It's also a public health issue. As News Channel 5's Sina Saleem reports, the African American community continues battling healthcare disparities.
When it comes to the coronavirus, Dr. Joseph Webb says it isn't surprising that African Americans are disproportionately affected by the virus. In fact, African Americans are twice as likely to die from COVID-19 compared to white Americans. But Dr. Webb says this shines a light on a bigger issue: systematic racism leading to healthcare disparities.
The outcomes of African Americans as it relates to health disparities has to do with a lot of the social determinants of health that are really considered as fundamental causes of health disparities.
Dr. Webb says Nashville General Hospital has a few programs in place to battle this reality. For example, they've opened a food pharmacy.
It would be in our best interest to provide them with some food sources, which would be much less costlier than having them get sick and come into the emergency rooms.
And their team went into the neighborhood to conduct COVID-19 tests in Metro public housing developments, since many residents don't have transportation. But more needs to be done. Dr. Webb says if we want to address healthcare disparities within the African American communities, we have to address social factors at play. Factors like access to healthcare, pay wage, and incarceration rate.
That tends to feed into other areas that they're not able to fund quite as well, maybe not afford, the proper housing or adequate housing or transportation or access to food or access to health care.
Sina Saleem, News Channel 5.